So much has been reported recently about diagnosing breast cancer and whether mammograms really do make a difference in reducing deaths. We're going to try to clear things up a bit. Dr. Zentner, a health specialist, is here. Hi there.
Hi.
So for decades, as you know, women have been urged to have mammograms regularly, believing they're an important tool in early diagnosis. Now we hear that they may not, in fact, reduce cancer deaths among middle-aged women.
So this is specifically, let's look at the facts. This is, when we talk about middle-aged women, this is women ages 40 to 59. This comes from a recent study published last week. The Canadian National Breast Cancer Screening Study looked at women 40 to 59. They were randomized to either annual mammography screening, just plain screening. So you go for your mammogram regardless of whether you feel a lump or not, versus a control. The two groups were followed out for almost 25 years. There was no mortality difference between the two groups. What this study suggests is that premenopausal breast cancer is different than postmenopausal breast cancer. We knew this, that it was different in terms of treatment and risk. Now we're finding it's different in terms of annual screening.
Detection.
Exactly. That's not, I found a lump and I went for a mammogram. That's annual regular screening.
You know, this is such a highly emotional issue because, as you know, all of us know someone who has had their cancer detected through a mammogram. What do you say to those women if now they're hearing, well, hold on, mammograms actually aren't that good?
No, I think we're not telling women mammograms aren't that good. We're telling women that in the premenopausal under 60 population, annual mammography may not be as great as at detecting life-saving treatment, so to speak, as we once thought. That doesn't apply to the over 60 population by any stretch of the imagination. It's this gray area that we weren't sure how to approach screening in, and now I think we have more information. Does it change the emotional aspect of things? Absolutely not. That's where the art of medicine comes in.
Right. And if it's not a mammogram for early detection, then what?
You know, I think what this shows, Donna, is that premenopausal breast cancer is a different beast. And I would argue that breast cancer in general is probably 10 different cancers in one. We need better detection for our premenopausal patient population. And that's what this study says to me.
That we need to work on that.
Absolutely. That's where we need to see what tests really do make a difference here.
All right, Dr. Zentner, thank you.
Thank you.